Legionellosis, a PowerPoint by Lauren, Bryn, Julie, Megan, and Gustavo. Legionellosis is a respiratory infection that occurs in the lungs and is caused by Legionella bacteria. The result of this bacteria entering the body can go into two diseases, Legionnaire's disease and Pontiac fever. Legionnaire's disease is going to manifest itself similarly to pneumonia, while Pontiac fever will be more like the flu. Legionella bacteria are very small and gram-negative. They're very motile, which helps them travel to the lungs once inhaled, but also in attaching themselves to a host cell. This bacteria is also aerobic, meaning it needs oxygen to survive. Legionella bacteria are able to protect themselves by the Legionella containing vacuole, or LCV. This will surround the bacteria once it has entered the host cell and prevent the host cell from detecting it as foreign. This enables the bacteria to continue working in the cell without being noticed and therefore preventing any immune responses. This bacteria also thrives in wet and warm areas, which will be discussed in detail throughout the PowerPoint.
The Legionella bacteria spreads through droplets in the air which come from bodies of water. And the bacteria normally spreads the easiest through man-made bodies of water because these have more of an opportunity to become aerosoled, unlike in nature. So they're the most prevalent in places with large water systems, ships, hotels, hospitals, and anywhere with air conditioning especially. And so that means that this happens in developed countries, but in places of poverty because those people have more risk factors to develop pneumonia and they do not have the money for better health care, unlike rich people. And it cannot spread from person to person because the bacteria doesn't go out of the body once it enters. So who is at risk? Most healthy people are not going to contract the disease because their immune system can fight off the bacteria that is trying to invade the lungs tissue. But people who have compromised lung function or immunosuppression are going to be more likely to contract it. So people who smoke or have a history of smoking, people with a sickness that impairs the immune system, such as cancer, or people who have had transplants, hospital patients on respirators, ventilators, or nasogastric tubes, because several of these will make a mist which has water droplets and carries the bacteria, people with chronic lung disease like COPD, and males over 50 are more likely to contract this disease.
So how Legionella infects the body. The bacteria gets into the lungs either through aspiration or breathing in of contaminated water droplets. And once the bacteria is in the lungs, it begins to infect host cells. And then the phagocytes will come and engulf the Legionella. And these phagocytes are mainly macrophages or monocytes. So flagella is thought to help the bacteria adhere to the host cells. And if a Legionella bacteria does not have flagella, it's not going to cause infection because it's unable to adhere to the cells, and so it is more susceptible to the phagocytes. And once the bacteria is engulfed by these phagocytes, it begins to replicate in the cell. And the intracellular replication continues until the bacteria runs out of space or nutrients. And once it runs out of space, it will burst open. And the phagocyte burst causes the bacteria to be released back into the body. And this causes the bacteria to be able to infect more cells and cause infection. Intracellular replication sends a signal and it calls and activates T cells to the site. And once the T cells are there, they produce lymphokines that increase the phagocyte's activity or ability to fight off these microbes and bacteria. So people who have an immune problem or who are immunocompromised are unable to fight off the bacteria, cease the intracellular replication because their body doesn't produce the immune response. And so that makes them more vulnerable to Legionellosis, whether that be Legionnaire's disease or Pontiac fever.
The most common symptoms of Legionellosis disease are coughs, chills, or high fever. Other possible symptoms the patient can have are muscle aches, shortness of breath, occasional headache, diarrhea, nausea, or vomiting. And then for Pontiac fever, which can be caused by Legionellosis disease, has symptoms much like influenza, and those are fever, headaches, or muscle aches. Legionellosis disease is treated with antibiotics. 3 classes of antibiotics have proven to be the most effective. Macrolides, and some examples of those are zithromax, azithromycin, erythromycin, and clarithromycin. Another group would be tetracyclines, and an example of that would be doxycycline. And then fluoroquinolones, and some examples of that are levaquin, ciprofloxacin, levofloxacin, and moxifloxacin. In many cases, the patient will have to be hospitalized for treatment as well as be monitored for other health risks. Zithromax and levaquin are used the most for treatment due to them having less of an effect on the GI tract, and they also have a greater potency and are given once daily. Rifampin may also be given to the patient as well if the patient's case is extremely severe. Treatment of Pontiac fever, there is no treatment, and any symptoms will go away within a few days. The patient can take any acetaminophen for muscle aches or headaches. The most common way Legionellosis disease is diagnosed is by a urinary antigen test. This test can detect the presence of Legionella within days of being exposed to the bacteria, and the picture on the right is an example of that test. A culture from respiratory secretions may also be taken. The sputum sample will be taken by the nurse and should be collected before any form of antibiotic is given to the patient. And the doctor may also ask about the patient's past health and working conditions. Pontiac fever is diagnosed also by a urinary antigen test or by a blood culture.
As mentioned earlier, Legionella, the bacteria that causes legionellosis, thrive in artificial water sources, such as fountains, hot tubs, spas, and cooling towers. Because of this, the disease has led to negative impacts in society. Some of these negative impacts revolve around the interaction and prevalence of the disease. Artificial water sources are used regularly, leading to this interaction with humans. Legionella also affect areas of lower socioeconomic status, as is the case with the South Bronx. A study conducted by Tiffany High in 2015 concluded that impoverished areas, such as the Bronx, were more susceptible to the bacteria due to the large amounts of industrial activity and lack of sanitation. This could be the case with areas all around the country. Despite its negative impacts, legionellosis has also had some positive ones. For instance, the World Health Organization has created guidelines to help educate society about diseases like legionellosis, in hopes to prevent future outbreaks. These guidelines include the Guidelines for Drinking Water Quality, Guidelines for Safe Recreational Water Environments, and Guides to Ship Sanitation, another environment where Legionella can thrive in. In addition, there are several standards created for building owners and managers to help minimize the risk of the disease. Current research revolves around the prevention, treatment, and control of legionellosis. Studies such as ones conducted by Lin and Yu study the prevention of the disease, specifically in vulnerable areas such as hospitals. Others study new detection methods. According to News Medical Life Sciences, a research group from the Technical University in Munich have developed a new way to detect the bacteria in patients. This test is more affordable and faster than the commonly used urinary antigen test. Lastly, in 2016, doctors from the Walter and Eliza Hall Institute in Australia discovered BH3 mimetic drugs, which obliterate infected macrophages. This is a new type of drug that could potentially provide a better treatment option for Legionnaire's disease.